My project is about open data. So following the government transparency movement and open science, there's a movement towards open government. And one of the things that President Obama did as part of his memorandum on open government and transparency is that he is really encouraging all sorts of government agencies to be proactively releasing data. And the idea behind this is that data that's produced by government belongs to the citizens. So as part of this, thousands of data sets are being released by various government agencies at the federal, state, and city levels. And there are all sorts of new opportunities. And so currently, there are a lot of opportunities for developers to create new apps. And there's also interesting potential opportunities for public health research and practice. So an example of this is that in New York State, one of the first data sets to be released was the nursing home bed census data set, which our former commissioner said was not a very exciting data set, but it's released and updated every single week. And when Hurricane Sandy hit, the nursing home staff were able to go into the data set and really see where are there some empty beds, and then they were able to use that to proactively help with emergency response and management. So my project is about thinking through to what extent are open data usable and fit and of high quality for public health research and practice, and to provide some recommendations on how we can improve quality and usability and fitness of data. And how do we think about how to make these data more sustainable? And ultimately, we're trying to build a robust community of practice around using open data to improve public health services and systems. So there are two things that we're trying to add to the field. So first is just to understand what open data resources are available and to help people use it. So we already have 2 papers out that are really designed to give people some information about the fact that open data exist. Our preliminary work indicates that a lot of researchers do not know about these open data resources, or they think that, well, they can't possibly be useful for what I do. So some of our work is just to understand what kinds of data sets are available, what kinds of things could they be used for, what are some existing use cases. One of our projects is that we're doing a pilot data linkage project to look at the relationship between childhood obesity and the built environment. So this is to see, can the data really be used for a more sophisticated research project. So that's part of it, is just to understand what's there, understand use cases, and promote their use. The second part of the project is to think about how do we improve the value and sustainability of these data. So here we're talking to practitioners to understand what are the barriers and challenges to releasing data, what have been some success stories, what are their lessons learned in developing open data platforms and releasing data. We're looking at individual data sets to think through, are they adhering to 5-star open data criteria? What's the quality of the data and the metadata? How do we make the platforms more usable and fit for researchers? So the second part of this project is we're just trying to provide some recommendations on how do we improve data portals, and increase the value of data. There's a lot of momentum and excitement about releasing data and developing open data platforms and this idea of open government. However, despite directives to be releasing data, government agencies really do not have a lot of guidance on how to do this. And what makes it more challenging is that open data has a lot of different possible user communities. So currently there's a lot of efforts around app developers, but there's a lot less effort thinking through how do public health researchers and practitioners, how can they use the data, and how do we tailor the data products for these different types of users. So some of the implications of the project is to really think through how do we improve the quality and value of the data. What's exciting and what we found is that there is a fledgling open data ecosystem. It's starting to develop, it's starting to grow, and so part of the project is learning how do we really support this emerging community of practice and how do we make this more sustainable. And ultimately, data are only valuable if they're used, and so the extent to which we can improve the value of the data, we can promote use cases, we can encourage people to use it, the more likely that the data really will be valuable. And finally, another thing that we've learned from the project is that we really needed to demonstrate some return on investment. So it's very easy to document the number of FOIA requests that go down once you release data proactively, it's harder to think through what's the value of other types of use cases and what's the economic value of data. So the extent to which we can support that, then our project can be successful. We went into this project thinking that this was a story about open data and how are we releasing open data and how are open data different than public health data. But a lot of our findings are that one of the major challenges is just quality of data and metadata, and general challenges of ideally we'd like to have interoperable data, we'd like data elements in the different public health data sets to be standardized, we want to make it easier to merge and to understand concepts across data sets. And I think one of the interesting things to emerge from the project is that people aren't necessarily thinking about open data as something differently, rather a lot of the challenges are about high quality data. So the project really shows the importance of continuing to work on high quality data, improving metadata and data documentation, and really trying to reach this high bar of data interoperability. And I think the extent to which the project can help us start those kinds of conversations, then that would be helpful.